Members of law enforcement are trained to help and protect others. Their struggles, many experts say, are masked, often not even discussed openly until it is too late.
We're not victims. That is not always true, right? And you know, we're human beings. We get depressed, and so I think that's the challenge we have.
That challenge is something Deputy Commissioner Ben Tucker is dealing with head on. Appointed by Commissioner James O'Neill, Tucker is leading a task force to look into the health and mental wellness of the force. This particularly more important than ever after the NYPD sadly lost another member to suicide over the weekend. 30-year-old Sergeant Terrence McAvoy was found inside his Staten Island home, presumably killing himself with his own department-issued handgun. Today, Commissioner O'Neill calling his death a tragedy upon tragedy.
These are extremely difficult jobs, and you couple that with whatever personal issues people have, it's not a good recipe. You know, people shouldn't feel that they can't come forward.
There are more members of the NYPD killed because of suicide than in the line of duty. While there are 7 suicides thus far this year, there were 4 last year in total. Tucker says it is now the department's priority to bring that number down. First, they are working to tackle the stigma surrounding getting help.
Our goal, as I spoke about a moment ago, is to really up front try to intervene early on with people who need help.
Hundreds of members of the Brass's senior executive staff are scheduled to meet in a conference in the next week or so. They will receive training and be educated to recognize important signs of mental distress within their own command posts. Tucker's task force even sending a delegation out to LA, where police departments there found success in bringing in clinicians and psychologists to make rounds at all of their precincts. That model expected to be replicated here with the help of Thrive NYC, the mayor's mental health initiative.
I couldn't imagine any of this happening even in 10 years ago.
So really some unprecedented moves by the NYPD. Another element in development, an mobile app, easily accessible help for any member of the force who wants it. The goal really to make this process comfortable and completely confidential.
Yeah, such an important issue. Now, I mean, did you find that there was any kind of common thread among those who did commit suicide?
That question was posed to both the commissioner and deputy commissioner, and there was no common link that they're aware of. While some issues could be financial struggles, divorce, or relationship problems, they say it could vary, but oftentimes, many of them are linked to the stresses of the job. And so it's a big reason why the commissioner says the department can't go on ignoring these problems. They have to take full-on responsibility to help those members.
And it must be having its effect on other members of the force, right?
Absolutely. I mean, there is no question there are some people that are rattled. One suicide is one thing, but this cluster that we've seen just from June, that has certainly shaken a lot of members in the department, and it's why they want to make sure that people feel comfortable enough to find help, get help, and continue to seek that help. And they say nobody has to know about it. That's an important part of it. And what we opened the story with was why there's this stigma. Police officers are supposed to be there to help others. They don't look at themselves as people who need the help.